And family, we are back again here with a Shot of E&J podcast. My name is Jeremy Anato-Mensah. I'm here with my co-host, Eric Igwe. So we're going to get into our topic du jour, right? And we're talking all about the healthcare industry, right?
Yep.
And the state of healthcare in particular in this country. But let's
go ahead. Before we do it, let's give a shout out to Hit Culture Digital. Like I said, they play a huge part in our developing our video, recording space, everything. They do it all. And so shout out to Hit Culture Digital. Please check their website, hitculturedigital.com. Hit Culture with the K. So don't forget it. The K. hitculturedigital.com. Go ahead, Jeremy.
All right, so getting into this topic, right? What is the state of healthcare in the United States right now? And I'll let you talk about it, kind of discuss your thoughts on it, and then we'll kind of bounce off of each other. But what are your thoughts on the state of healthcare?
It's in dire straits. I mean, it's crazy right now because you're thinking about the rising cost of prescriptions, for drugs, the rising cost of prescription, all these drug costs. Yeah. You're dealing with higher deductibles. Yeah. I mean, that you got to address. I mean, and it depends on which employer. Some employers are great and have great coverages. Other employers don't have great coverages, and you have to deal with that. So you're talking about rising drug costs, right? You're talking about healthcare plans and the cost of healthcare increasing. You're talking about paying for deductibles. Mm-hmm. We're talking about Medicare. For people, for the people who don't know, Medicare, right, is for people who are 65 and older, right? Or people with certain disabilities. And so Medicare, is insurance to the government, right? Right. But we got even issues there through Medicare because while it covers a lot, it doesn't cover currently dental, vision, or hearing. Yeah. So imagine you got a loved one, 65 and older, right? On Medicare right now. Medicare as of today does not include dental, vision, or hearing. That's crazy. Right. And you're talking about you got to go outside and to get those services addressed. Dental is a must. It has to be part of it. It has to be part of any healthcare plan. So you're talking about those issues on Medicaid. You're talking about the drug costs. You're talking about the rising healthcare costs and high deductibles because deductibles are going up every year, right? Right. And we're in October this year and into November this year. This is during open enrollment period. So all of us got to make huge decisions within our companies, right? Between our employers or going to the open market and trying to determine what is going to be the best health care and cross your fingers that your health care plans does not increase because they have been increasing. And so dealing with that, even the cost of having a kid, like it costs money to have a kid, to bring a kid into this world. Right. And so we're talking about the wages not being the same, right? Because we're not at $15 an hour, right? We're $7.25, right? Currently. So for people on $7.25 wage per hour, they got to deal with rising healthcare costs. They may not be in the position to have great healthcare coverage, right? So you're paying high deductible, paying a lot out of pocket, and you're not getting a lot of your plan. Dealing with the high drug costs. So it's a huge issue right now that we've been dealing for a long time. And, Obamacare has helped out. We'll talk about the legacy of Obamacare. Has helped out in a lot of ways. But, I mean, there's been talks about it right now to address it. But, there's been talks through this, for you guys heard it, this infrastructure bill, right, a better buyback plan, the $3.5 trillion reconciliation plan. Part of that does include trying to address lowering prescription costs, maybe expanding Medicare to include dental, vision, and health. So do you feel like the state of healthcare? You think it's great, groovy? Everything is going great, or you feel like, hey, man, we got some serious problems?
I mean, like you said, all of the things you highlighted are what we're dealing with right now. I think that, when it comes to healthcare in this country, it's always been an issue that we sort of have taken for granted or overlooked for a certain demographic, right? So if you have a good job, you know, and you're making a decent salary, you know, and your employer is one that provides an adequate healthcare plan, you don't really worry about it because you've got decent coverage. Case in point, I'll say for a brief second, I work for the Department of Education, the Federal Department of Education, and they had, you know, as do I think most federal government agencies, but they had just so many different options that you could choose from. And it was almost it was overwhelming to a point because you had to try to research these different plans to enroll. And so it was probably the first job that I ever had where, you know, you actually needed to do like considerable research, right? A lot of jobs give you 2 or 3 plans. You choose one, and then, you know, maybe you have a flexible spending account or a health savings account, something like that. But it's pretty basic. And it's like, hey, you choose either the low plan or the high plan. Boom, you're done. Maybe a third plan if you work somewhere that has a lot of choices. So I think it's really, really an important issue, and it's hard because it is so dependent on where you work, right? Think about it from the standpoint of people that want to go and become entrepreneurs, they want to be independent. Well, where's their healthcare coverage going to come from, especially if they have a family, they have children, all that type of thing. So it really sets the stage for our conversation today because it leads us into what should the government be providing as sort of a baseline for people, right? And is that something that, you know, we all want to see collectively? Is it something where we're like, you know what? It's a Medicare type thing where it's like a certain segment of the population, we want to make sure they have health care. But for the average person, you know, get it how you live. You know what I'm saying? I personally don't think that, but I think that's what, you know, ultimately we get into. But I think first, though, before we do that, we got to talk about your boy. We got to talk about your boy.
He's our boy, man. Come on, man.
You know, I want to
put some respect on President Obama, man.
I want to claim him. I think, you know, in many ways, his legacy is Obamacare, aka the Affordable Care Act, right? It was such a monumental piece of legislation and a big accomplishment. I will say that, but it didn't come without its fair share of issues, right? So we want to sort of center the conversation on that a bit. So what are your thoughts? Talk to us about the legacy of Obamacare.
It's tough. I think overall it is a crowning achievement because, you know, the healthcare industry for so long, people have been suffering during it. People forget that the healthcare industry, we were in a lot more dire situation before President Obama came in. Let's not forget that. You know, you're dealing with the health insurance, healthcare providers charging all sorts of prices. Exactly. If you got pre-existing based on your health status, they can kick you out and not cover you.
It's a big thing.
You know, you got some lifetime out of pocket. You know, like there's just a bunch of things that people had to suffer because I felt like healthcare industry had, especially the healthcare insurance providers have free reign. And I think President Obama came in and he put Obamacare. Now, I would have wanted the public option, and I think there was a push back then, battle to have public option. That failed. Maybe there could have been momentum, but I think there was a lot of push for public option. And for those who don't know what public option is, public option essentially having a combination of your private insurance, not only having an option of private insurance, but also have an option to get insurance through the government. So it's keeping the private insurers, right? The Aetnas of the world, United Healthcare, Cigna, all those major ones. But you can say, hey, you can choose to either get your insurance through those providers, through your employers, or you can get insurance through a government option. That's what we mean by public option, is having both options, a public option. And I prefer that, you know, those have been talks and been pushed for that because maybe the government can then, having people go into public option, the government can negotiate prices and help drive it down, which will make the industry more competitive and force the private the private insurance companies to adjust, right? If they still want to remain competitive in their market.
Best case scenario.
Best case scenario. But that there was a lot of push for it, back and forth. Ultimately, it felt right. But President Obama, I say it was a success overall. I think there could have been more public option push. I wish for an Obamacare. But, yeah, you had the individual mandate because part of Obamacare, what makes it successful, or the big push was we need to get everybody insured, right? Mm-hmm. There was numbers about 20 more people. I think they able to get 20 more million people. I think I read 20 more million people insured because of Obamacare, right?
Right.
And then not only that, individual mandate, you get on insurance, so you face a penalty. That's a bit controversial. It allow for students. Imagine if you're a student, right? And because I wouldn't say when I was an undergrad going in for the first couple of years, I didn't have health insurance. I think it was through the school maybe. Yeah. But I didn't really have, like, there's others who are like, hey, I don't have health insurance, so I'm taking this risk out here, right? I'm in college. So now that you can, Obamacare allowed you to stay for dependents, such as kids, to stay on their parents' health insurance until they're 26-year-old, which is huge, right? You're talking about that. Able to cover pre-existing conditions. So in regards to your health status, they're gonna assure that you're not denied coverage, right? Mm-hmm. That is huge. Covering pre-existing conditions is a game changer.
Yeah,
big time. We can say we want protecting people with pre-existing conditions as a game changer, because imagine if you don't, right? Then you're paying for out-of-pocket costs. And who the heck can pay for those out-of-pocket costs, right? If you don't have your insurance saying we're going to cover it, and we're going to cover it as far as paying for deductible, and we pay for our co-insurance portion once you cross your deductible. If it's not covered, you're paying what the hospital tells you it costs, and it's going to cost you 2-3 times more. And so covering pre-existing conditions is a huge game changer.
It is.
And then they use subsidies to help lower health insurance coverage, especially people who are in great lower income or great financial need. You have subsidies that will help lower your health insurance because you get into the market, pick a health insurance plan. There's subsidies added into it. But the Obamacare also heavily relied on a lot of young people. By making an individual mandate, they get a lot of more younger people, healthy people to pay into it. And that's helped makes Obamacare balance it out. That's the huge thing. And then those subsidies is going to help address and make it cheaper for people who are more lower income financial need to get health insurance. Mm-hmm. What's your thoughts?
I think, Obamacare, the legacy of Obamacare, you have to talk about the pushback that Obama got from trying to really make it policy and make it law. And unfortunately, we sort of entered this period of time where, I guess, nonpartisanship, if you will, or if you want to say bipartisanship, I guess Democrats and Republicans working together, sort of was at a standstill, if you will. And really, you had a lot of people that were of the opinion that Obamacare was forcing states and forcing individuals to take part in something that they didn't feel that they should have to, right? Like, why should I be penalized if I don't want to, go and get healthcare coverage? I don't really have a way for it to be provided to me. And so now I'm getting penalized under this plan. But in effect, we all end up sharing the cost of it, right? Because someone doesn't have coverage. And we've seen this. That's the thing about COVID has really shown us this, that you see it when, you have all these people in the hospital. The hospitals are overwhelmed. And people don't have coverage. Who fits the bill, right? And it ends up becoming all of us, effectively as taxpayers. And so it makes sense to have a requirement that individuals get a plan that a lot of times the government is already subsidizing, is providing a plan for a cheaper rate that they would be able to get on the open market if it was just, a free market type of system where there's no government programs at all. So Obama, he changed a lot, and he did a great thing. And pushing through Obamacare, like yourself, I really wanted the public option. I thought that would have really put a lot of pressure on insurance companies.
And remember, Democrats in 2008, they controlled the House and the Senate.
Yeah.
And you got the White House, right?
And I think the thinking of the time was we shouldn't shove this down their throats because it could come back to haunt us if, we lose control, and then you had the Trump administration. They tried to undo Obamacare, and they, to an extent, they were successful, right? Or
but they weren't able to do a full repeal.
Right. But they repealed some key parts of it. But nevertheless, I think the point is that the legacy of Obamacare is solidified. It was a great initiative. It was a great program. It helped a lot of people, minorities included, individuals that never would have had access to health care, and the disparities that we're seeing, even in this current state, would have been even, exacerbated even more. Yeah. So for that, I got to salute, Mr. Obama. I have my issues with him. I got my issues with President Obama.
We're gonna have a whole different topic on that.
Yeah.
Let's just give him his flowers on Obamacare.
He
before you go on,
I salute him for that.
We're gonna have our topic on that. But I want to ask this question: is healthcare a right or a privilege?
Healthcare to me is, I would, and that's it. That's. I'm thinking about this.
See, I
real
put you
time.
on the spot right there.
Yeah, you did. So in some ways, healthcare is a right, because I think, regardless of who you are or what background you're coming from or where you grew up, whatever, you should be able to be healthy, right? And healthcare is providing you with the health, whatever it is, whether it's, developmentally, or you have issues with some of your organs, or whatever your issue is. But then there's a point where I think we all would argue that this is above and beyond what should probably be the standard. Let's say you have a certain brain condition that requires a lot of a lot of resources from the healthcare system. You know what I'm saying? Doctors, nurses, other practitioners that are actually trying to help you, deal with this condition that you're going to deal with for the rest of your life. Should that be covered by our system? Is that something that the system should be responsible for, or should that burden fall on, your family or some, Yeah. So but if I had to lean one way, I would definitely say it's a right.
And when I'm saying right, as far as, there's conversations about people who are saying, hey, it's really privilege. Some people think it's a privilege. Like, hey, if you got a job, you should be able to pay for it. It's not something that should be given to everybody. Going back to a topic we'll talk about later on universal health care, like, should everybody have access to health care, right? Or is that a right? Or is it a privilege that, hey, if you got a job, then the privilege is for those who can afford health care versus people who have a right. Overall, I feel like healthcare should be a right. It is a critical need. I mean, you can't work a job. It's hard how can you truly work a job if you're not covered through, if you don't have health care addressed in some form or fashion. I can't concentrate. If I didn't have insurance right now, I'd be freaking out. Mm-hmm. So, it is a critical part of how you govern and how you and for you and your kids. I mean, it puts you a great state of peace of mind to say, hey, I got some coverage. Now, what degree of coverage, that's a whole nother story. But no, I just think as in this country, if we're going to live in life, liberty, and the pursuit of happiness, right, that's talked about.
And I was going to touch on that, but I don't want to interrupt. Go ahead.
And we talk about life. Part of ensuring that we have that life is making sure that healthcare is addressed in some form or fashion. So for me, healthcare is a right.
So just thinking about this idea of a right versus a privilege. So first of all, will we say that the founders, I guess, did they intend or did they state in some way that healthcare was a right? I think they're on shaky ground now. I don't know necessarily, but
and that's why we're asking the question. Like,
and totally agree. But I think our conceptualization of healthcare is much different now. I think back in the 1700s, 1800s, we didn't have this capitalist system as we do now, where you go to a doctor and you pay a fee in exchange for healthcare. Maybe you went to your local community doctor, medicine man, whatever, and they helped you deal with your ailments, or maybe someone in your family was aware of different properties of natural remedies, be it plant extracts and all that kind of stuff to heal you. So I think that's a right. I think that idea that, health and wellness, you should have the ability to address your maladies is a right. I don't know if modern healthcare is a right. I don't know. That's kind of a, you see what I'm saying? The current conceptualization of healthcare. I don't know if that's a right, because I don't know that. But then, you get into this whole idea of that's sort of the evolution of health, right? Because back then they might have used a medicine man, but now we use doctors.
Yeah.
And we've gone through, the iterations of getting to a point where, okay, now the medicine man is certified. He went to school. He's using tried and tested techniques to heal you, right? And there's been this certification process with the drugs, everything. So I don't know. That's a good question.
I mean, if it's not a right, then it's hard for you to get true access to healthcare.
Yeah.
Just like as everyone else, because it becomes a system, or like it is to some degree, where if you're wealthy, you can get quicker access to doctors. There's people who go to clinics or public clinics, and they have to wait or get on a wait list to see a doctor. Some have to wait 30 days, right?
Right.
Like I used to, when I was working nonprofit, I used to deal with that, or you used to hear so many cases about that. People have to wait a long time. If you're wealthy, you could go right to the doctor. You can have a doctor come to your house right now and say, hey, come address this. Hey, let me get the best medication.
So are you dealing with, though, because there are a lot of systems around the world. I know we got to move on, but there are a lot of systems around the world where you will have to wait for healthcare. Like there is this idea of universal healthcare, but it's not an immediate attention given to someone that's in pain or they go to a hospital. So is it a right to have immediate attention, or is it just a right to have the issue addressed?
I mean, to me, it's a right to have. I'm talking about right as far as having access, especially equitable access to healthcare. To me, that's what I'm talking about in regards to a right. Rather than it depends on it's based on social economic, where, man, if you're wealthy, you get these certain level of accesses, versus if you're not wealthy, then you have to go to this doctor, right? Versus this doctor, or because if you're not wealthy, then you have to deal with you have a different insurance provider who provides you less coverage, or because remember, think about this. If you're wealthy in a better position, you can get some of the best health insurance companies. And then the list of doctors that under the coverage expands. You might have a higher quality doctors because you have a more expensive health insurance plan, right? Versus someone right now, and my mom's example, where she worked in a nursing home. I one day looked at her health insurance plan. It didn't hardly cover much. It barely covered some of the preventative services. It was bad as far as coverage. It got to the point I looked at it. I said, it doesn't cover much. You're paying a lot into it, and it doesn't cover much. I have to tell her to cancel it, to switch, because and she's ended up paying more out of her pocket, but at least she gets better coverage than she would have ever got if she stayed in the health insurance plan, because she's dealing with a provider who is about giving you the bare minimum health insurance plan. That doesn't hardly cover much. Barely covers some of the preventive services. So this is where I feel like it becomes a privileged class issue. That I felt like, hey, these some stuff needs addressed. And that's why when we come back from our break, we're gonna have some topics about Medicare for all versus public option versus different systems today. What do we think is best? Here are our thoughts on what system is best. So stay tuned and hear that on the Shot of E&J podcast.